All right, Jack. Patient assessment, medical, geriatric sepsis. You have 15 minutes
Okay.
to complete this skill. Are you ready?
Yeah.
Okay. You are dispatched to a nursing home for an 88-year-old female that's altered mental status.
All right. So, BSI, is my scene safe?
Your scene is safe.
All right, that's my only patient.
Yes, sir.
Okay, my nature of illness is altered mental status. I'm going to dig out the root of that. I don't think I'm going to need additional resources, but I'll keep it in mind that they're there. And then I'll consider ceasefire precautions.
All right, so the nurse, she meets you at the door. She says that Mrs. Jones has had a UTI for the last 2 weeks. She's on antibiotics. In the last 3 or so days, she's become altered mental status. Really hasn't gotten out of bed, hasn't been eating.
Okay, so I'm walking in to see my patient, get my general impression.
You see her laying in bed,
Okay.
uncovered by any blankets. Her skin is pale. She's not alert to you walking in.
Okay, so from there I'm going to check her level of responsiveness and for any immediate life threats.
So you don't notice any life threats. Her level of responsiveness, is verbal.
Okay. But she does respond to the verbal stimuli, so.
Yes.
All right, well, from there I'm going to move into my quick assessment, my ABCs here. I'm going to check her airway. Is she talking, protecting her airway?
She is, yep.
Okay, no.
She doesn't really making sense, but she's talking.
Okay. I'm move into my breathing. I'm going to make sure that she's breathing adequately with depth and volume, keeping in mind oxygenation if I need it to.
Okay, she's a little shallow.
Okay.
18 breaths per minute.
Okay. Any signs of cyanosis or anything in the skin?
Yeah, you notice maybe a little bit of bluing at the fingernails.
I'm put on some high flow oxygen just
Okay.
because we're there. I'm gonna check her circulation there. I don't see any bleeding anywhere.
Nope.
Cap refill is gonna be my generic go-to. Does it fill up appropriately?
It's less than 2 seconds.
Okay.
Or sorry, greater than 2 seconds.
Greater than 2 seconds.
My bad.
So kind of low blood pressure there, potential. So just based off a quick assessment there, I think this is somebody that's going to need transported immediately, rapid transport.
Okay, her skin is pale, cool, diaphoretic, and pulse is rapid
Okay,
and regular.
awesome. So now I'm going to move into some of my history taken. Hopefully the CNA can answer, or the nurse can answer questions. She'll
So,
just get back from vacation.
Lucky you, the patient's daughter is there.
Oh, okay, perfect.
So she said that she has a Foley catheter in place all the time and deals with UTIs. She's had this UTI for 2 weeks and has been on antibiotics.
Okay.
The antibiotics obviously have not been working.
Okay.
Onset was about 2 weeks.
The altered mental status has been going for 2 weeks?
Altered mental status has been going on for 3 days.
Okay.
Anything else you'd like to know with your OPQRST?
Is she complaining of pain or anything at any point?
She said that the Foley catheter is kind of giving her some pain, mild pain. The patient just says it hurts. She's not able to give you an actual
Can't
number or
describe
anything
it or
like that.
anything. Okay. So then I'm moving my samples. So signs and symptoms. She's altered and pale. Like got some outward signs there.
Okay, allergies. Penicillin and sulfa.
Okay.
She takes metropolol for her AFib.
AFib. Okay. So then, after going through my sample, I'm gonna get into my vital takings. I'm gonna have my partner throw her on a monitor. We get a 4-lead.
Okay, 4-lead is sinus tac 120.
Okay, we're gonna get blood pressure.
Okay, blood pressure is 60 over 20.
Based on presentation and low pressure there, being a little soft, we're gonna get 2 IVs going, like the C18s, but we'll take two lines that we can get.
Okay.
Oxygen and blood sugar, just because she's altered.
Okay, on your high flow, she is 94%
Okay.
on 15, and blood sugar is 100.
Okay. So, kind of run through some stuff there. Is there a temp?
Yeah, temp. She's 96.
96. Okay. So, like that treatment for shock here, I'm gonna get a blanket placed on my patient. Try to trap some of her own body heat in there and warm her up, actively warming her. Concern here is going to be sepsis,
Okay.
and that we're long term there, so that's my field impression. Treatments, I'm going to start fluids, so I'll be giving lactated ringers, department policy of 20 mils per kilogram, and reassessing. And then I'll go ahead and drop 4 of norepi and put it into a 250 ml bag of D5W. And at that point, I'm going to set it into the pump, hopefully, and I will be trying to get 8 micrograms of norepi into our patient to try to get that pressure up. We want to keep it permissive there. We're looking for 90 to 100 systolic. And then you can do a gram of calcium afterwards, try to help facilitate some of that pH goodness there.
Okay.
And from there, I'm going to move into, like, if we haven't started, we need to get going. We should be moving. This is a rapid transport.
All right, you got her in the ambulance. You're headed to the hospital.
Okay. Start checking our vital signs. I'm going to reassess all of my interventions, make sure that they had good positive effects, like my pressor is working.
Your pressor is working. She is 90 systolic.
Okay. Check pulse, make sure that her AFib hasn't started firing off or any new developments there. Is her mentation changed at all?
No, you've noticed that her AFib's been controlled by her medicine.
Okay.
Because she wouldn't be in sinus stack. She has a history of AFib, so she's in AFib.
Okay. And then I'm going to keep in the back of my mind the need to possibly intubate, maybe have stuff set out and laid out on the counter ready to go based off transport time.
Okay. There's anything else you'd like to add?
No, I'm good.
All right, good job.